Hello everybody and welcome to the HacettepePathology Case of the Month series. And in this month I'm going to present a 30-year-old male patient with a gingival mass. It has been treated with antibiotics, but it doesn't resolve, so they took an X-ray showing a lytic mass in the anterior region, and here is a biopsy from this case. And as you see, there's a spindle cell tumor just eroding the squamous epithelium, and it's composed of spindle cells with some myxoid areas, and it's infiltrative. As you see here, it's infiltrating the muscle, and there's also a clue that this is also infiltrating bone or originating from bone. But once we had correlate with the radiology, we can say that this is a primary bone mass. Just just go out from a bone and infiltrating the surrounding soft tissues. And when we get close, we see the cellular spindle cells, and they have hyperchromasia. They look malignant, as you see here, and it has abundant mitotic activity with some areas of epithelioid cells and myxoid areas, as you see here. Some necrosis maybe here and there, and some cells may resemble rhabdomyoblasts. And the first thing comes to mind in these regions with the spindle cells is rhabdomyosarcoma, of course, but they did a keratin. Here, there's the keratin. This is nice squamous epithelium, and the cells are positive for keratin. So here's a dreadful pitfall to call this sarcomatoid carcinoma, but one should be aware of a relatively new entity as a keratin positive subset of rhabdomyosarcomas, which has been recently described. And here is the desmin. Desmin is very nicely demonstrated here, and the cells are desmin and cytokeratin positive. And of course, other myogenic markers or rhabdomyogenic markers like myogenin. Myogenin was also largely negative, so you shouldn't be stop here. You shouldn't stop here. And okay, here there's just one cell or two, and of course in these cases myogenin could be negative or very focally positive, and you should order also MyoD1 given the spindle and epithelioid morphology and keratin and desmin co-expression. So here is the MyoD1, and it's almost every cell is positive for MyoD1. I'm giving the diagnosis of epithelioid and spindle cell rhabdomyosarcoma. And of course, here is another marker. This is ALK, ALK is also positive in a subset of spindle cell rhabdomyosarcoma called epithelioid spindle cell rhabdomyosarcoma. These tumors are also ALK positive, but it's not associated with any ALK alterations, either amplification or mutation or rearrangement. Also, these tumors doesn't respond to ALK inhibitors. And again, a feature of this tumor is EWSR or FUS rearrangement, and the partner gene is TFCP2. And in this case, FISH was negative for EWSR1, so we thought that it should be FUS instead of EWSR or other FET family of genes like TAF. And in summary, these tumors are found in young males and maxilla and the epithelioid spindle cells, which co-express desmin and keratin. ALK positivity also might be helpful. These tumors are of poor prognosis and do not respond to chemotherapy or radiotherapy, so surgery is the mainstay of treatment. Thank you very much, and hope to see you next month.